The obvious thing, which is the work schedule, no more shift work. You don't have to apply for a day off, or like a weekend off 3 months ahead. That's most obvious. But apart from that, in terms of what the work I do here in a GP clinic, I get to see many different health issues. So at the hospital, you assign to a ward, you will see quite repetitive things, and you do your daily work, and it gets a bit mundane after a short while. But here you get to see babies, see many different health issues in the community, which you don't usually see at the hospital. If you work in the GP for over a year, and you get to know the patients, and then you see how the baby growing up. They come in for a care plan review every 3-4 months, and you get to see their health condition either improve or deteriorate. And then you can really get to know them, and then start building trustworthy relationship with them whenever they come see you for vaccine or weight check or sugar level check, some things like that. And then once that sort of the bond built, then you can really talk to them about things they can do day to day to improve on their health. And that's what really, I should say, GP health is preventive care. Once you get to know them, and then they will really value what you say to them. A lot of things that seem to be very obvious, but it's actually maybe for healthcare workers, but it's actually not that obvious to just the general public. That's the thing I found, yeah. So even small things you say, it can really make a big difference. And they really appreciate of what you say to them and really listen. And that's something I feel is quite different to hospital nursing, because hospital you just have your list, you do everything for the patients and all that. It's really more doing. Here it's more of the, I should say, health education, and that's, it's kind of rewarding. Yeah, I like many things about this clinic. Yeah, I'm planning to retire from here. Yes, I don't want to, I think that's pretty much as good as we'll get. And so the environment is very nice. It's a very beautiful clinic. It's a good location, it's easy access. If you drive, it's very easy. It's a free sort of car park, which is very hard to come by in the central Sydney area. And the people work with, especially the doctors, super friendly, nice. They're never too impatient to answer them my questions. Because when I first started, I was fairly new, I would say full-time, especially position to primary health GP nursing. And the management, super approachable as well. And they always try to meet like personal sort of needs. If you need to do something, working time, it's never difficult to approach to them. It was never the case. And the rest of the team are very friendly. And then, and everyone is just very nice to work with. I should say, easy work with as well. And the patients here are also very respectful either way. And I learned quite a few new skills here. Cannulations, one of the skills I learned and get practice a lot. Vaccines over the years, last year especially, we've learned many as well. What to say to people, and then make them feel more, I should say, comfortable when getting the vaccines. And the skill base. What else? And also, another thing I found very appreciative is the membership with APNA. Usually it's not covered by the clinic, but Green Square House is very generous. The other thing I really like about working here is Green Square House is really focused on keep staff safe, especially over the COVID time. So we have an air purifier in each room. It will make me feel safer working here, especially seeing patients with symptoms. We have to be extra careful, which is what we do here. Another thing is great about Green Square House is they're always looking for ways or means to do things better, how to deliver better quality care for patients, and how to make the vaccine program run more smoother. So they're always trying to do things better, and it's try to keep up with how I would say the society evolves, and then so we don't get behind, or at least just keep on top of everything. It drives me to sort of think more proactively as well. And if I make some suggestions, and then they will always very kindly just take in the review, or just say, oh yeah, we'll try it your way first and see how we go, and then get things reviewed. Yeah, don't feel like being heard. Right? Yeah, so that's it. That's all.